No.
That's just one night. Gotta come back for the next.
You're giving me kind of PTSD here.
I know. Things that nature. I feel like certain nurses who don't do that, I look at them with a real bad, bombastic side eye. Like,
Hey guys, welcome to Nursetalk, the podcast where we talk all things nursing. My name is Mia, and today we have Ashley.
hey.
All the way from Ohio.
Yes.
Thank you so much for coming.
For sure, girl. I had to. Yeah, let's take it.
Yeah, let's do it.
Let's do it.
Okay, so you've been in healthcare for 14 years, a nurse for 9.
Yes.
All right, walk me through how you got into healthcare and then what led you to nursing.
Well, it's going to sound kind of cliche because I feel like everybody, like, what's your nursing story? But for me, my grandma was a diabetic growing up. So I would always go take her sugar and everything. Like I would check her sugar before we went to church. And then I was fascinated by it. I was like, what is that? You know, like, why are you poking yourself? So then even just being younger, like in the 5th grade, I would like go out on the playground and like play nurse. I don't know. It was a thing. It was totally a thing.
Wow, I love that.
And then also my grandma, like, she had real bad arthritis. So she like had this, it's this cream called Sonomo is what it was. It's called Sonomore, but like she said, put that Sonomo on me, you know? So like what happened was I would just like massage her legs and massage her hands and everything. Cause she actually has rheumatoid arthritis. Now that I'm a nurse, I know that now.
Yeah.
And she'd be like, oh baby, your hands are so healing. You just have such healing hands. And I honestly think they spoke it over me. It had to be because she'll always say like, your hands are blessed. Like you just have such healing hands. And that's what she said. And I just believed it. So, and it was crazy. And then, I mean, like, every function, oh, Ashley rubbed my leg so good yesterday. And it was just like, I mean, I did.
Yeah.
So that was honestly the starting point. And I believe she spoke it over my life, honestly, because I know I'm supposed to be here. You know, I just know. So I think that's how it happened. And now here I am.
That's amazing.
Yeah.
So when you started healthcare, did you start as a CNA or were you working?
Yeah.
CNA?
So I actually I worked at Lowe's for a very long time. Like I looked
Lowe's?
at Lowe's Hardware. I was a cashier and I was in nursing school. So I never did anything nursing, but they wanted to be the STNA and stuff. So when I was supposed to do the STNA, I was a cashier at Lowe's.
Yeah.
And then I started taking the class. Like once I started getting into nursing school, I just applied in the place where I was living in Columbus at the time. And they were like, oh, you're in nursing school? Okay, yeah, come start. We're going to train you to what we need you to be anyway. But like as a tech, I was phlebotomy trained. I did blood cultures. I got IVs. Like their thing was so like the techs did so much at that hospital that once I got that baseline, I was like, oh, okay, like this is cool, you know, and then nursing school. And so bye-bye Lowe's, hello nursing, you know. So it was, I learned a lot. I learned a lot at the bedside as a tech. And then when I became a nurse, I felt like I just knew everything at that point.
It's crazy because
skills wise.
100%. I just think people who start out as a tech are just so ahead of the curve because it's like, you know how to like
everything.
Time management, you know how all the basic skills, you don't have to go back and learn everything else. Yeah. It's just what changes from here and what are my new responsibilities.
Right. Yeah.
Which is amazing.
Yeah. And it's crazy to think that too, but you don't realize how much you learn even when it comes to body mechanics and like transferring and all that stuff. All that plays a role, even when it comes to getting your own blood work, because I do that at our facility. Like some places aren't as privileged to have lab. You know what I mean? They just aren't. So, I mean, but I can tell you one, it won't stop my flow. I can tell you that much. I know that for a fact. It will not stop nothing over here, honey. I'm like, so that's how that works.
That's amazing. Okay. So what would you say was like the biggest obstacle as a new grad?
I would say time management, and things just aren't as they seem when you're in clinicals, you know?
No.
So when you're in clinicals, you learn, I don't know about you, but for the first few months, you know, rounds, we were in nursing homes. So then we were in nursing homes. They tell you how to do A, B, C, and D. And then you do these care plans and that's how you think it's going to go. Oh, when you are on that floor, and I started off at a very high acuity floor, these people want you to give them their pain pills, come back, hurry up, and get me into bed, especially working night shift. You know what I mean? And or if you're going a day shift, you have to prep these people for surgery. You have to do a lot of stuff prior to actually treating the patient. Like it's not that. It's just not that.
There's so much more to it.
It's a lot more to it.
It's like my chicken fingers are cold. Now I got to call.
They want you to do it all. And that was another thing, priority. So that was the biggest thing for me. I would say the biggest learning curve was time management and priority. Because if you were in a patient's room thinking that, well, not even thinking, but getting distracted with all their tasks, and you have 5 or 6 other patients on your load, you're not going to know which one to, you're going to try to appease them because you're a people pleaser, or like you want to be nice. And I work with adults. I don't work with kids, honey. I work with grown folk. Okay. And they want it, and they want it now, and or they like your energy, so they want to talk to you, and you just can't. And that's the hard part for me, because I yap. So I do not mind a good yap session. And that was another thing. I'm like, I can't be in here. I cannot be in here and get all the things done that I need to be done. So time management and prioritization were the biggest things, for sure.
Yes. And then you get to the end of your shift, and it's like 14 hours, and you haven't peed or eaten, and you're just like. What are the ratios like? We'll talk about it. Med-Surg, you know, all those things, oncology. Now you're in rehabilitation. But what are the ratios in Ohio?
In Ohio as a whole, I would say 1-6.
That's what it is here.
Yeah.
Unfortunately.
I would just say one. Like, I feel like it is 1-6. No matter when. If it's a good night, you might get a 5, 5 patients or whatever. But if you have 5, that 6th one's going to be an admission.
Oh yeah, absolutely. One time I had 7, and I was like,
yeah. When I first started at the facility, when I first started a few facilities, I had 6 plus 7 for like 3 to 4 months, and it was horrific as it sounds, But you're realizing like, what,
Yeah,
and
it's When you're brand new too, it's hard to say no.
Yeah.
It takes you a couple of years to be like, actually, I'm not taking that assignment.
Yeah. I don't even know what that sounds like. I honestly because they brainwash you. They make you feel like you can't say no.
I know. It takes you a long time to learn.
Now I'm like, listen, no.
Yeah. Finally, I've been a nurse for 5 years, and finally I got to the point where I'm like, no, I don't think that's acceptable. I'm not going to take that.
Right.
Just now.
Yeah.
Like recently.
Yeah.
Yeah. And plus it's, every time you walk in, it's like everything's on fire.
No, you don't ever know what you're walking into.
And like
that's nurse. Like,
everyone else is already mad.
Yes.
And like, so it's like you don't want to be the one that's like,
guys,
flag. No, I'm not doing it. You know? So you have done Med-Surg, oncology, you've done transplant, step down, and now you're in rehabilitation. So tell me about how your nursing journey has gone.
When I first became a nurse, I started at a hospital in Cleveland, and it was it was transplant. It was kidney transplant mostly. We did a lot of kidneys, livers, like all of the things. So I was there for a year and a half, and I knew once I left there, I can do anything. I knew it right off the bat because a lot of the transplant patients have terrible veins. I mean, terrible, terrible blood draws. And guess what? They got to go to surgery. So you got to get their blood. You got to get their stuff. They're fresh kidneys, fresh livers, fresh everything. So we'll have patients come in at 6:00, and then we will have to prep them. They'll go down to surgery at 8, and then they'll be back by 11. So at that point, that's all on my shift. So I'm a day shift at this place because I did rotating days and nights, and it was 40 hours, and it was as terrible as it sounds. So, I mean, it was just a lot of work, you know what I mean?
Yeah.
And once that was with a high acuity patient on top of 4 other patients on that assignment. So that taught me so much. And I knew once I left here, I'm like, I'm going to be fine wherever I go after this. And and fine I was, you know, and I left, and this is before COVID or anything. So I left and went travel nursing for a while. And when I did the traveling, that's when I got into the oncology and the rehabilitation and all that stuff. I've never done rehab prior to travel nursing. So I did transplant for about a year and a half, and then my next assignment was at a rehab place.
Okay.
And funnily enough, that's where I met my husband.
Yeah.
I was like,
wait, was he one of your patients?
No, girl.
I was like, oh my gosh.
Yeah, no. But he lived in the same city.
Okay.
He lived in the same city that I was at the time.
Okay, awesome.
So literally, and girl, he just didn't leave after that. So anyway, and I met him on my first travel assignment.
I love that.
That was just, I felt like it was meant to be. But anyway, I was at a rehab facility there, and I really liked it. I learned a lot about FEMS and like just how to categorize patients. And I just felt like the patients there, and that was my first time ever working with LPNs. I worked with a lot of LPNs because it was a rehab facility. So I was just like, oh, okay, it's not a nursing home and it's not the hospital. So yeah, it's pretty cool, you know?
Yeah.
And that's when I kind of started learning about the roles of an RN and the roles of an LPN and how you can delegate and all of that. So all of that kind of just mixed into one. And I really enjoyed the rehab, but it was more it was just temporary because I was on an assignment, you know.
Yeah.
And you had to learn another skill set, which was how to score these patients. How are they going to look when they go home? So you have to learn how to score and all this other stuff.
I've never done that
You have
before.
to take a whole test. Like, it's a whole thing.
Really?
And sometimes you have to get certified in it too. So
I didn't know that was a whole thing.
It's a whole thing. It's a whole thing. So I wasn't too fond of that when I first started. And now here we are, because now I'm back in rehab. Then I went to an oncology. And I would honestly say that oncology it was still on the same travel assignment type of deal. And that oncology was more of a Med-Surg step down. We had oncology patients, but it was still Med-Surg. You know,
I did the same thing for a couple years.
They have cancer and they're medically unstable.
Oh, absolutely.
That's how that worked. And that's when I was just like, oh.
Did you have 6 patients there as well?
Yes. Yes. Dilaudid drips, all the things. And as a traveler, they're not nice, honey.
No.
They're not. They're not. They don't want you there.
Here's the worst patients.
They
all 6 of the worst patients that they can give you.
Or like you're getting in trouble at like that. Like they'll want to people just, because you're still learning the flow. You only get a couple days of orientation. So, but I mean, I know nursing. It's not like I don't know how to be a nurse. I know how to run a feed tube. I know how to do PEG tube stuff like that. They never had me pass like oncology medication because I wasn't oncology certified. So they had their own specific nurses for that. But yeah, and I only did that for as long as the assignment was, and I got out of there. This is fun.
No, it's terrible.
It was bad.
It's not only a very hard floor to work on because, you know, half of them are totals, half of them are there for liver cirrhosis or you know, sickle cell or like it could literally be anything.
Lots of sickle cell.
And then you have, you know, your oncology patients, which is such a sad thing to experience. I mean, of course, for the patient, but when you're taking care of them, you know, even if you only take care of a patient 2 nights in a row, you're still building a connection with this person, and it's so sad. So not only is it like, oh my God, difficult because it's Med-Surg, but it's also now you have the cancer aspect, and it was horrible.
Yeah.
I was like, I never want to come here ever again.
Yeah. And it's just, and honestly, like I said, I feel everything so deeply. That's just who I am. And I'm unapologetic about it now. Because at first I felt bad, like, oh, but no, it's just like, that's just who I am. I wear my heart on my sleeve and I don't know how to fake anything. So, and that's okay. That's okay. That's okay. That's not anything to hide. It's something to be proud of because at this point too, you know, like I'm genuinely connecting with these patients and they love me down and I love them down.
Yeah.
But also, when it becomes stressful or hard, you know what I mean? Like hard. I remember, I still say this to this day. They're like, well, how's your night go? I'm like, girl, I'm about to come in here and lay with you because it's stressful out there. You know what I mean? Like, please scoot over.
I know.
You know, like, can I come stay in your room? So, and they're like, honey, come on. Like, and I love that. So that, like I said, I think when you are not all business, and you show emotion, then that is how you connect with people. It's a people job.
I know. And unfortunately, I feel like maybe this isn't correct to say, but I feel like a lot of the people who do well in oncology don't feel as much.
Yeah.
Because the people I would work with that did like really well and just kept it like baseline, like they weren't, you could tell they weren't feeling what you were feeling. Because I was always so, I don't know how to describe it, but I was always like, I feel bad, but like, I can't do this. Like, this is so sad. Like, I take this home with me. And how are these people like working here for 5, 10 years, 20 years? I'm like, I can't do this. Does that make me weak?
No.
You know?
Yeah. But it's just probably what you're supposed to do.
Yeah.
You know what I mean? Like, I know some fields I don't want to be. I'm like, no.
Yeah.
No.
There's something for everybody.
There is. It is. Seriously.
That's what's wonderful about nursing.
It is. It is. Yeah. And now currently I'm doing rehab nursing, and who would have ever thought, a full circle moment again. And I absolutely love it. Like, I didn't know, but where I'm at right now, it's like acute care rehab. I honestly feel like I've never had an ACLS for a rehab, honey. And when those patients come over, they post-op a lot of the times, and you still have to keep a very good eye on them. But then they just have a lot of medical complex diseases on top of their stroke they just had, on top of the gunshot wound they just got, or on top of the spinal cord injury, or whatever it is.
Crazy.
It's a lot, but I like it because it's a nice pace. Like, we have our own standalone facility, and when anything gets bad or anything, we just call 911 and say, hey, you got to take them back to the hospital.
Which is wonderful.
I love that. You don't realize how much of a privilege that is until you are juggling a declining patient on your assignment, and you can send them up, but like send them up to the ICU or whatever, because I did step down. You just don't realize how nice it is to just be like, you know what? Oh, you're not doing too. Hey, 911, like
100%.
Take him back to the hospital,
100%.
because he's not medically stable to be here. You have to. It takes a lot to get into our facility, and you have to be qualified for it. Your insurance have to be good. You have to be able to do it, so you're not just bringing nursing home patients to us saying, rehab my mom. Your mom ain't walked in 2 years, lady. Like, I'm not sure, you know what I mean? You don't, and she doesn't feel like people just don't want to, you know what I mean? So, but I do like that part. I love the fact that a lot of our patients are independent. I mean, a lot of, not independent, but they have their independence prior to coming to us.
Yes.
So a lot of them are medically stable typically. And, but then something happens, they fall, they break their hip, they get in a car accident. I just have had the nurses, I've had all walks of life that I've taken care of. And I love that. Aww. Or they just are, something happens, like they'll be a housewife and next thing you know, a stroke, because they're 70 and they're like, oh, I was out to dinner with my daughter and the next thing you know, I had a stroke. And then we're here and we don't even live here. We live in Florida and you're in Ohio because we just came up for blah, 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 blah. It's crazy. God. I mean, it happens all the time.
You must meet such interesting people.
I do. Yeah. And I love that.
Is it still 6 patients?
Mm-hmm. Yeah. And it's okay. I mean, it is what it is.
Is it a little less than maybe like an oncology floor?
Yeah.
Or is it just as much?
Like,
are you giving around the clock meds?
Like, not really. Like, a lot of my patients don't have IVs. So that's already a thing.
When
I'll take it. And like, if they do, it'll be one PICC line. And then if it's a PICC line, then it's like, oh, okay, well, they have an antibiotic that they ran. It's once every 24 hours or something like that. Yeah. Because they came in with MRSA or some type of nasty infection or something. So that's fine. And then the rest of them are just post-op patients. They take their pills and most of them just go to sleep, and or they're learning getting up in the middle of the night to go to the bathroom, stuff like that. So.
Do you guys have resources like physical therapy and all of that?
Yeah.
Yeah.
Okay, good. Oh yeah. During the day, because I'm at night, honey, I don't know what goes on in the day shift. I don't know what goes on in the days. Actually, I do. But so we work with physical therapy, speech therapy, and occupational therapy.
Love that.
Speech therapy is the people who've had strokes, they get all 3 therapies because they need them, you know?
Of course.
And when I was studying to take my certification for rehabilitation nursing, I learned so much because speech is about sequencing, like all of the things, like being able to recall and just how your mind is and how, it's very involved. It's very involved. It's very multidisciplinary. And I didn't know how multidisciplinary it was until I really got into it. And I was like, yeah, this is where I want to be.
I love that. You found your place.
I did.
That's amazing.
Yeah.
So which specialty would you say challenged you the most?
Transplant. Absolutely. Absolutely. Because you don't know how much the body functions when you realize your liver isn't good, or when your kidneys aren't good, or when your blood pressure, all of those things. And you have to get new kidneys, new livers, new people have NASH cirrhosis, fatty liver. Like, I learned so much in that stay. And it was so hard because, like, for example, NASH cirrhosis can happen at any age. We had 40-year-olds who had to get a new liver because liver just went bad. But as far as just learning everything and being challenged, oh yeah, because it was just the charting. It was getting everything done and feeling that pressure from your coworkers, the people who come before you, the people who came after you. And if you didn't get anything done, they were like, well, you didn't do this. And there's certain medications that you have to take, like IVIG, like you have to give these meds in order to help their immune system. So if they're not getting it, it's a problem. And then if their blood pressure is down, you have to give them lots of, you may have to do a blood transfusion. You have to do so much in a 12-hour shift. And I just felt like at that time, first, the people who I worked with were meh, when as a new grad.
Not.
Oh, no. As a new grad, they were awful. They were terrible. That's just what
Instead of like, how can I help you? It's
no.
like, why didn't you do
I have
this?
a story about that if you want.
We're going to get to those.
So it was not a very, so automatically you're put on defense and you're like, I need to learn this stuff myself. And I don't really feel like I can ask you guys for help. You know what I mean?
And that's terrible.
And it is. And it is. And it is.
Because you have like 100 questions a shift. Like, I still have questions.
Yeah.
All the time.
And it's not a very, it just wasn't that helpful. So, but I did learn a lot because I did have a preceptor, although it was very controversial having her, but she knew her stuff.
Yeah.
So having her help me understand that, this is how it happens in the real world. This is how it happens on the floor.
Yes.
This is how it happens. This is how you really deal with a peg tube. When this, and this, and like stuff is flying at you. You know what I mean? Like, so I thought that was really helpful, but it still was hard. It was still very hard. It's probably one of the hardest jobs I've had for sure.
I can only imagine because just the medications alone.
Mm-hmm. And they have to do transplant medication. So you have to get their tacrolimus and Prograf prior to the blood draw that
stuff
you have
you've
to do.
never heard of.
So prior to their blood draw, and we don't have lab. So of course you don't have lab. I have to get two of these people will have, a PICC line, but you need cath flow because the cath is not coming out. Then you have to go stick these people.
God.
Oh, they're kidney patients. So of course their veins are crap. You know what I mean? So, and that is all before
40
you
minutes
get to leave.
later.
You can't even, I have to do this before I leave my shift. I have to get this blood work. I have to, because if not, the residents are going to come in and I'll be like, oh, we didn't get blood work. Oh, their blood is down. Oh, their hemoglobin is 6.2. Give them a pint of blood. Give them 2 pints of blood at 6:10. Do the type and cross.
No. Please. No, I've been there and it's the worst.
Do it. Like, it was just.
And then you don't even start charting until what? 8 o'clock, 9 o'clock? No.
That's just one night. Gotta come back for the next.
You're giving me kind of PTSD here.
I know. And then when you come back, oh, there's someone always waiting for you. Did you know you didn't get this done? Well, you didn't try that the right way. And you're like,
literally, I was.
It was horrible. Like,
honestly, I feel like anywhere you work, you're gonna have those, but some units, like it's like more often than not like that, because it's just the expectations are way too high,
and it's a lot of high acuity patients. I had a nurse who we actually finished our review course together. She worked in the ICU, and we worked in the same hospital at a point in time, and she came downstairs and she floated to our unit. She said, I do not know how you do this, Ashley. This is crazy. These patients are not stable. They're all 5 and 6 patients. She said, I'm on the, MICU, and I only have 2 patients. If I had, these people are one step away from being upstairs. I said, girl, I know. Right.
And how long did you do it?
A year. Maybe like a year and a half. I knew when I left there, I'm going to be fine.
Oh, yeah.
There has to be something better out here later that I'm not standing here.
This is the trenches.
Yeah. But honestly, and this is so real, I could have stayed a little longer. Now that I think about it, I feel like nurses just when they're ready, when they're up, when they're done with it, throw their hands up, find something else. The grass is totally not greener, and we'll get into that too. But the grass isn't always green on the other side. And I do feel like even though I was a new nurse and I knew that stuff, as far as like developmentally and as a, someone, if you go to a new facility as a traveler, just being alone, you don't really have that confidence yet. And I feel like if I stayed and got my confidence up a little longer, I would have really been able to like handle the negativity that came with being completely solo in these streets in the nursing field. You know what I mean? Like you come up to a new hospital, honey, they checking for you and they're it's not.
And they're mad because you're making more.
So but then you're just trying to be there and make friends or, hey, da da da. But they're like, not.
So when you took your travel assignment, you didn't feel like you could make friends and all the things?
Not really, no.
And that's unfortunate.
I'm at certain places. Let's just say that. I love every place that I did go to. They were great. I remember one place I left, they gave me a cake and everything, and it was a rehab facility I was at.
I love
Still love those
that.
people down. I mean, I've gotten friends with patients from there and everything. So those were nice, but just depending on what city you were in and what the vibes were, honestly, it was all about the vibes, honey. And if you're at one of the bigger hospitals, I found that smaller hospital, that's why I love smaller hospitals. The bigger hospitals just seem like a checkbox, like, oh, I work for, and it's like, good for you. Like,
Yeah,
you know
yeah.
what I mean? Like, but even while working there, they weren't,
Yeah, like you're not doing anything that anyone else can do.
but I felt like when I worked at the smaller facilities or just little like hospitals that weren't as big name brand, it was just so much better. So I can't say all of that it just depended on where you went on your contract. Yeah.
Well, that's good. I'm glad, because if
I'm
everyone
still
was
best friends are my nurses. I mean, me and my nurse friends, we literally, girl, we travel every year, like, and it's just great. Like, I just have and I met them on my travel assignment. I met my husband during my travel assignment. Like,
so it was meant to happen.
It was meant to be. So whatever, you know what I mean? Like,
whatever came with it is fine. Yeah,
it helped. It helped.
Would you recommend Med-Surg as a starting point for new nurses?
I would. I wouldn't say you have to do it, but it doesn't hurt. You know what I mean? And especially, I feel like I never had the desire to work with kids. I know adults. I don't know babies, like I just don't. That's just not my strong point. But I know how to get, in nursing school, and when I like learned my training, enough to pass a test. But I just felt more comfortable with adults. I just felt like I just know them, and you use that everyday life. Like, what's the stable vital signs? What's this? What's that? Like, normal. I know normal on everybody 18 and up.
Yeah.
I know it.
Yeah.
And I believe that when you have that knowledge, it's just so broad, and that's just it. I think that at least for the first year or whatever, but they do, like, I know people say you get pigeonholed in there and you have to stay, but a lot of these step down floors and whatever are just Med-Surg with a sprinkle of so and so. That's the thing. That's the thing. And I honestly think, like, I felt, for me, when I did my clinicals in college and everything, I passed out in surgery. Like, I don't like dirty stuff. It's just certain things. Like, if I see a wound, I need it to be clean. Like,
oh no, I could never do wound care.
Staples. You know what I'm saying? Like, those are the things. So I'm not like, I don't have an adrenaline rush for that. No. And then I learned about babies. My girlfriend, her wife is a pediatric nurse. Oh my God. I mean, she works at a very high acuity hospital in Houston. And she was saying how I didn't know that the babies could go blind if they don't have oxygen. Like, certain things, like just little things, like little critical things that deals with an umbilical cord that you're like, wait a minute, you had to draw blood from what? Like, it gets, so I feel like you're not me. You don't pay me enough to be dealing with somebody's baby umbilical cord and doing all that. Like, let those people who want that do that. I just do not feel that's just not where I want it to be. So anyway, I hope I answered the question. I do feel like if you want to specialize, hopefully you can like go shadow floors and stuff. But I think it gives you the best well-rounded experience as a nurse. I do think that. So.
I think the way you described it is honestly the best I've ever heard it, because I remember I got floated to transplant on like Christmas, which was so rude. But anyway, and I remember being like, oh, I can do most of this stuff. I just got to look up a couple meds. And I'm sure they gave me their easier patients that was a little bit more appropriate for me to have. I'm sure there's more to it than what I personally saw, but I didn't feel like it was out of my control when I went there. Yeah. Because I came from Med-Surg to transplant, or when I did, floated to pediatrics Med-Surg. Yeah. It's like,
or I didn't feel cardiac. Like, if you're doing cardiac, you're going to a Med-Surg floor, honey. It's just patients who've had a stroke yesterday. Or had a heart attack yesterday. Like, that is what it is. Or ortho. It's Med-Surg. Like, it is. But now you're over here passing pain pills every 2 hours.
Which, or even oncology. Yeah. It was literally Med-Surg, but you add in, they need chemo at 8:00.
Or you need to put, and they had chemo, so now you have to do the precautions moving forward today. You know what I mean? But that's little stuff like that. Yeah. It was just like, oh, okay.
I don't think everyone has to. I think some people, get things faster than others.
True.
And I would say I'm probably on the slower end. Like, it takes a second for things to like really click for me. But I do see how some people will be a nurse for like 6 months to a year and they just get it. They get it all. They don't, like, they just understand it. They could be charge nurse after 6 months, like do everything. Yeah. And those people I would say don't
use them
have
as a resource.
Yeah.
Yeah, for sure.
But I think for me personally, starting in Med-Surg was perfect.
Yeah.
Yeah.
And then I felt like some of the people, like, I know I've seen nurses now who have started in the ICU or they go into the ICU and it's just too much.
I can't even imagine that.
Listen, when they said you need to do, like, it's you and that patient, and you might have a decent preceptor, but you really are going to call on your preceptor a lot. And if y'all not clicking and you ain't learning too much, you know what I'm saying? So as a new grad starting off at the ICU, that's a tall order depending on where you go and where you live. I feel like if you've been there and you feel comfortable and you know people, you know, but for me, no.
I can't even imagine that.
It's
starting in the ICU.
That's
crazy.
And it's good if that's what you wanted to do and you have a path. But like, I know a lot of nurses. Okay. And I know that a lot of us don't necessarily have a straight and narrow path. You know, like, I'm going to go here and I'm going to boom, 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 boom. That's fine for you, but that's not everyone's story. You know what I mean?
Exactly.
So, and that's okay. You know, you kind of have, there are people who don't even do healthcare anymore. So that's like, once you're in there, you're like, do what? Go back
Depends
to
on
no
honestly,
way.
It depends on the day.
It does, honey.
Ask me tomorrow, I might have a different answer.
I'm grateful for it, but it's just like, yeah. So I do think going through Med-Surg will take you. You will know what to do if anything were to happen to your loved one, your family member. You know, all the things too. So
yeah, I love that. I always say, nursing, even if you don't want to stay in it for a long period of time, you learn so much about like different diseases and different age groups and so much that will help you in your just average everyday life. Yeah. So how is rehab nursing different than acute care?
I feel like acute care is medically unstable patients all the time. And you're mostly figuring out how to get their blood, give them a blood transfusion, make their blood pressure come back up. You're trying to do all the things to keep them from going up to the ICU for the most part. They're acute.
Or Jesus.
Yeah. You know what I mean? You have to be more focused on pain management, pain management, blood pressure, all the things medically that can just tank them quick, which is, it can be a lot. It's a lot. But as far as like where I'm at with my rehab patients, I have patients who have already gone through the acute stuff. So they're coming to us post spinal cord injury and they're learning how to deal with their life now that they have a spinal cord injury. They can't go pee or poo on their own. Like, there are things that are life-changing events that now they're learning how to do again at the deficits that they have. So now I have stroke patients who have aphasia, who can't swallow. They're in their 50s. They struggle with high blood pressure because they don't have, they don't have enough time to take care of themselves. So now that, boom, now they didn't got the stroke. You know what I mean? But I feel for the rehab portion, life happens and it happens right then. You get in a car accident, you can't walk afterward. Like, that is just, it pulls me back into reality all the time. And I feel like they just have, they're a little bit more medically stable and they're just learning how to really move their body again and trying to be the best version of themselves with this new diagnosis.
Do you feel like it's changed your perspective on life a little bit?
Oh my gosh, yes. Yeah. I call my mom all the time. Like, I'll tell her just stuff like, don't lock that door because you live alone. And you know what? Just everything. I just think of all the craziest things of how someone can get hurt. And it's just like, okay. I mean, obviously I'm like almost a little worry ward at this point, and I never was like that, but I mean, there are just things that can happen in a blink of an eye and change the entire trajectory of your life. And you have to be, I mean, people are in there crying every day because they're like, my life is different now. So
that must be tough.
It is. It can be a lot, but also I feel like I can meet them at their lowest point and kind of help them get that spark back. You know what I mean? Or like help them navigate those emotions from my 4 or 5 shifts that I'm working in a row. But during that time, I've built people just I built such a good connection with those people. And I mean, I've had patients come and bring me stuff or like, just stuff. And it's nice because at the end of the day, no matter what the ratios are, no matter how the management is, what they feeling like that week or whatever, it is about the patient, and you want to make sure that you leave a lasting impression on them. And I do feel like I can do that within rehab. Whereas sometimes when you're pushing meds and pushing acute care and giving the blood and doing all the things that you lose that. You're a taskmaster.
Yeah, absolutely.
In acute care. Mm-hmm. You're a taskmaster and you better get it right now.
Oh,
but
yeah.
like with that's the biggest difference I have seen. But with rehab, you have patients who you're still a taskmaster, but you kind of meet them where they are to help them become the best version of themselves in the new body that they're in at this point,
Yeah. And what a privilege.
It is. Yeah.
So what does success look like in rehabilitation nursing?
Oh, ringing that bell.
When they get to go home. Yeah.
Ringing the bell. Oh, we've had patients who've been there 40 days, 30, 40 days from a stroke. Typically.
That's a long time.
Yeah, it is. And, they have to learn how to walk. They have to learn how to climb the stairs again. And it's so crazy. Even though I do work nights, I come in and they're drained because your body just is so... A stroke takes so much from you, when you're learning how to walk and do all the things again. And just being able to see them with a flaccid arm, they'll be like, Ashley, look. And they'll pull their arm up, be like, something like that. And you're like... Oh,
I don't know why that gave me chills when you just said
literally.
That. Yeah.
It's crazy because it's like, and they this is what we did today in therapy. Okay, I'm doing this now. And like learning how to mechanically move your body. So you have to have a shower, you go into the bathroom, you got a grab bar. But you can't flop down on the toilet, Carla. You gotta, ease it down, slow it down, Granny, But they'll be like, oh no, wait a minute, I got it. And then they'll sit down. Because they already were so independent. They're 88 years old. And now this crap happens.
I don't want your help.
Yeah. Don't touch me. Wait a minute. You're like, oh, girl, show me what you got. Show me what you're going to do today. That's kind of how I've So, and being able to do that and see that's the biggest part, is to ring that bell, know that you got your therapies completed. You're not as strong as you want to be or you once were, but you are progressing towards, and I feel like in nursing school, this is a side note, plan of care. The plan of care goals and the outcomes and all that stuff, that is so rehab. I use that stuff every single day.
Really?
Care plans. Never used them before. Like, what the heck with the care plan? Plan of care is what I map them out. I have to say, patient's going to do this by 14 days. Patient's going to do this by 13 days.
Oh, wow.
Patient's going to have stable blood pressure and or temperature and not show signs of UTI. Those are the things you have to think about within rehab because they are a plan of care. How are they going to be? What is their outcome?
Because it's no longer just task. It's like
outcome.
Outcome. Absolutely.
How are you going to go home and what's it going to look like when you do that? And that is the thing. Like I said, those are probably the biggest things from acute care to now. And I like that.
Yeah. It's amazing.
Yeah.
Okay. So you've been a nurse for 9 years, right? Mm-hmm. I'm sure you have so many stories. I'd love to hear a few.
Since we are on the rehabilitation portion, it was on my travel assignment. I had a patient who was going Christmas shopping, and it was a really bad winter and it was a lot of black ice, and her 13-year-old daughter was with her, whatever. And she fell. And when she fell, she hit the back of her head on the back, like a plank, like where you park your car at, kind of like a little rod, like steel. And she was paralyzed from the neck down.
Oh my God.
To the point where she was in her 40s or 50s or something like that, younger. And now the whole trajectory of your life is different because you got too many bags in your hands and you're rushing and you're putting the clothes in the thing, and then you turn and then you fall. Falls scare me.
Oh, absolutely.
Falls scare the heck out of me because I've always said I'm too tall to fall. I've said that since I'm playing basketball and all the things. Like, I take the charge. Who? Like, I'm not voluntarily do what? Like, no. And yeah, that always put like a worry word, or like somebody who has had a stroke in their house and they live alone and they weren't near their phone, or they don't have a life alert because they're 50, or 60. And they've been down for 3 to 4 days and they have rhabdomyolysis now. Their kidneys are shot and they have sores on their arms because they've been down and someone just happened to come by and talk, check in on them. Those have definitely put things in perspective for me because I'm just like, oh my God, like, what? Like I'll call my mom, like, oh girl, just checking on you.
Yeah.
Like, just to see
you
what's
not doing anything
going on.
crazy.
Yeah. Like, I just need to, I'm gonna lay eyes on you. I'm gonna come home. Like, let me see what's going on. I call her all the time. So when I first became a nurse, and I said this on my, when I first became a nurse, it was very difficult. It was just so hard because you're in acute care and all these things are happening right off the rip. So I have put in place with a preceptor, and we lived in a very, like, I was in Cleveland. So it was very, you get all kinds of patients, a very hodgepodge of people, very, all kinds of cultures, backgrounds, things of that nature. And I remember being with one of my preceptors, and she was nice. She knew her stuff. She was very, very intelligent, very confident. And I appreciated that, because you feel confident when you're following a confident preceptor. And she taught me a lot. But if she wasn't dealing with you, she wasn't dealing with you. You know, like, she was just very, like, she said a lot of questionable things. And I had a situation where it was not her original weekend, and it was an opposite weekend that she typically doesn't work on, and she does charge nurses and all the things. And she asked someone to do something. It was like a tech. She asked someone to do something, and the tech was like, "Oh, I'm about to go on breakfast." Like, no, like, just kind of walked off, because they do that too. People do that. They just, like, it's not working with my schedule, so no. So that was like the first, like, no, you know, like, when as a nurse, you're delegating, like, oh, okay. So my preceptor looked and was like, "Oh, there's too much chocolate on this weekend. I don't need to be here," or something. Like, I need to go back. She said, "There's too much chocolate on this weekend. I want to go back to my weekend," pretty much.
Wait.
Right.
Okay.
Yeah.
Oh, I would be calling managers left and right.
So
no way.
And I'm passing meds. So I'm in here giving my patients meds, and she said it close enough to the nursing station, but close enough where everyone could hear her. So one of my girlfriends who, she's been a nurse a little bit, but she wasn't a preceptor at that time, but we talked all the time. And she's like, "Oh my God, did you just hear?" And I was like, "Yeah, girl, like, what was that about?" But mind you, I'm not you don't want to come off face. You just don't know what to say. No,
you're fearful
position.
And you're like the underdog.
And you're mad. It's just so many emotions, and you're learning. So it just was a very awkward position. And thankfully enough, like, she was fired after that.
Good.
She was fired within 48 hours.
Good, because that's a horrible thing to say.
And but I just feel like those are the personalities you deal with, no matter what. They can hide it, they can say whatever, and it's not, I don't know, like, you just don't talk to people that way. You don't talk to your coworkers that way. If you're here for a common thing, like, you are supposed to work together. And it was the craziest thing. I mean, it was honestly within the first 3 weeks of me.
You were like, "Oh my God, I don't know if I want to be a nurse. People are mean, and not only mean, but racist." So is that your only experience dealing with that, or have you come across that?
With racism?
Yeah. In nursing?
No. Yeah, that was not my only experience dealing with that. From coworkers, that was the most blatant thing. But as far as, like, from coworkers when I was traveling or what have you, they don't do a racism thing. They do like a 50 questions, because I was young. Like, so as a young Black nurse, I'm 23 years old. I have the same BSN as you, honey. Big BSN. Okay.
Mm-hmm.
It's almost like it puts people at like and I'm pretty and I have all the things, you know what I mean? Like,
and you're tall and fit.
Yeah,
and
like,
you look cute.
At me as soon as you come in, you're like, calculating. What is going on? I didn't know you were a fan, honey. So so that is and that's when I had to really learn how to be confident. Really learn that I know my shit, and no one's going to tell me anything other than that. So I feel like it came off as like, "Oh, so how long have you been a nurse? Oh, well, how have you been here?" And blah, 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 blah. It came off as 50 questions, because then they will come up behind you and be like, "Oh, well, Ashley didn't sign this medication off." Or, "Oh, well, she missed this antibiotic that was due at midnight, and the patient said that she didn't get in there until 1:30.
Oh, whoa.
And you have a complaint, and then it done. So that is kind of what I experienced. So I'm not going to say there may have just been, I'm going to be a bit, I benefit of the doubt too dang much. But that's my thing. Like,
almost like
maybe,
a target.
Yeah, like, it was just like, oh, well, maybe they are just trying to. So, and then as far as like patients, nah, I mean, yes, but no. I feel like it's more of like an energy thing. You can kind of feel it if they know, like, I don't really want that to be my nurse anymore. And or it's just a personality situation. Like our personalities may just not go together. And I don't think it's because you're racist. I don't like pulling the race card because it's just so much more that goes into nursing than being racist. It can come in as our personalities just don't match.
You're type B, I'm type A, or vice versa.
And you're not going to boss me around. That's the thing. People some personalities want to tell you what they're going to get done or what they're not going to do. And that's fine. But if you don't like the way I do it, then you can have another nurse.
Oh, yeah, of course.
And that's kind of how I am now. And I'm okay with saying that and being that way. So I don't, outside of that blatant racism that happened at my beginning of my career, everything else is just like, it could be,
but you don't know.
Could be, but I'm not going to speculate.
But it wasn't as obvious as saying there's too much chocolate. Oh my God.
That was the craziest thing ever.
I'm glad they got rid of her because I feel like people get away with so much.
And she
in the
had
hospital.
a following. Like her followers were the other nurses on the one.
Okay, you mean like where she works or like
where we were?
Okay.
Yeah.
Okay.
The followers, like I call them the minions almost. Like she was the nurse who was there for the longest. She was there. She was she had power. She was the charge nurse. Her friends made the freaking schedule. Like all of the things. And then now, like it's like, if they think, oh, Ashley's not a good worker or so and so, like, oh, I precepted Mia and Mia just was so slow. Well,
yeah. Well, then now everyone thinks that because she said it, kind of thing. Yeah.
And or it's like, oh, well, Mia's having a baby, so she knows, she's going to need the 312s before Ashley has it because they decided who got 312s because we worked 40 hours. We did the 212s and 2/8s, and then you had a waiting list of who could be on the 312s, and it was just like you would get. Oh, well, maybe next schedule because we don't have it right now. You lying. It was that. So those are the political underbelly things that you see and you're like, what is happening here? It's crazy. So that's why when they say you don't know drama until you get into nursing because
you would never expect that.
It's high school on steroids.
It literally is. And it's like, this is a profession.
Mm-hmm. Yeah. So that was the thing. So that was the situation. Like you had her say something like that so comfortably. And so while precepting and on a weekend, that's not her weekend because the A weekend were her people who worked on her weekend. So when she said that and it was just no backtracking from that now, that's when our manager was like, absolutely not. Cut the show. And I just had so much respect for that. And she's a great manager. She was a great manager. And although that nurse knew a lot of stuff, it just really wasn't. Ignorance has no
bounds,
face, color, nothing. Like ignorance is just what you. I'm gonna just say what I say. It's like,
Well, it's very common to have managers that don't step up.
Oh yeah.
So I love that.
Me too.
Yeah.
Yeah, and I feel like when you have a very wide range of nurses. I mean, we had German, blacks, white, Indian, all kinds of nurses.
Filipinos.
All kinds of nurses on one unit. You know what I mean? So it wasn't just monolithic. You know what I mean? Like, it was just like, oh, okay, well, you're gone. and goodbye. And I had so much respect for her. And I think she was one of the better managers that I've had at a facility that I have a great manager now, but yeah, still.
To have
someone who's on your side.
Such a crappy situation, but then have a good outcome. I mean, that's the only good outcome there could have been.
Exactly.
So good for her.
Exactly. Yeah. And then I had oh girl, these family members, although it is rehab, they are there for weeks. That's another thing. So we don't get a turnover 3 to 4 days patients. Like they come and they stay. Mm-hmm. And stay they do. The lady was doing laundry in the sink and literally washing clothes and pants and everything and like putting it up on the shower thing and everything, like just washing stuff in the bathroom, which is fine, but like, honey, go home. I mean, coming in here with like suitcase, because they come with suitcases.
Yes.
But take the suitcase home to do the laundry, because so that was crazy. I like walked into a patient's room and they had like a cot, they had their laundry up. And then there was this one time they had like a little skillet, like literally a skillet to make whatever food they wanted.
Bacon
yes. Like I'm like, are you going to put a steak on that? You know what I mean? And it was just like, okay.
They're getting comfortable.
This is a bit much. I can't even move. Like I can't even get in here to get the ladies' vitals. Like, come on. So
at what point do you have to get management involved and say, like, they have too much stuff? Like I can't, like it's a safety hazard. It can't get to the patient.
I think it just depends on who the management is at that point. Because it's just like they're helping their loved one, it's a stressful situation, so they kind of let them do their thing. I did have this one patient, this when I was working in Columbus at the time. And it was when I was a tech, actually. It was like right before I became a nurse. But I already knew what was going on. I was like, okay, this is how it is. There was this guy, he was homeless, but he was on the unit, and I think he just had an infection he had going on or whatever. So he had an IV. But this guy, he literally was refusing to sleep. He didn't go to sleep for like 4 days. He did not go to sleep. He didn't go to sleep. So delirium set in. Mm-hmm. So he was running. He would always push the call out. I need some snacks. I'm hungry. I need some snacks. Whole time though, he's getting all his pain pills around the clock. So he's just like flying high as a kite. If you ask me, I knew he was. He was feeling all the way good. Still not sleeping. His partner gets admitted into the hospital as well because of how, I don't know. I'm not really sure how that happened. But when I tell you, we go into their room and we come into the room, the partner's in the room with him, also admitted on the same unit, also homeless or whatever. And it was a parade of snacks everywhere. Like it was just so much food in there. I mean, it was like hoarders almost, like, cause he's there for 4 or 5 days and all the snacks in the unit are just like stashed away in this place and everything. And it was just kind of, I was just like, and he's walking down the hall and he was just like talking crazy by this time because he just was so tired and everything. And I just laughed. That's when I knew this is the hotel. Indeed, this is the Ritz-Carlton, honey. If you ain't got it, we got it for you. You want a snack? Come on over. Like, it was just the craziest thing. That was like when I first was like, oh my God.
One of the first things I learned on the Med-Surg unit
is the hotel.
Literally, like, if you have a homeless patient, you have to feed them like every 2 hours with snacks, drinks, unlimited. I got to the point where some of them, they wouldn't ask me, and it would be like, oh, it's been an hour. I'll just walk by with a soda and some graham crackers or whatever cool snacks we had that day. Because I was like, please don't call me. I have so much to do.
It's just, you just don't know what you're going to get. You know what I'm saying? Like there are some people that when they are, we deal with so many different patients all the time. So when you do have those homeless patients, like they have a personality trait of their own. And that is the craziest thing. You're like, what? Like, and I gotta go do what after this? And you keep calling me. It was just crazy. Patients, just delirium. Whole time he's high as a kite, going back into his room with his partner, eating all the snacks. I was just,
honestly, I love it though, because they'll mind their business for the most part if you just give them the snacks.
No, yeah, for sure. And that was the thing. He was just, okay, y'all good. Okay, everyone's fine, bye.
Yep, so, exactly.
Especially with Dilla, because like I said, everything can be so serious all the time that like when you have someone that just want a couple of snacks, it's just like make their day, whatever, keep going.
Like I have no rules on that. I'll give you as many as you want.
Yeah, I'll come double up. Okay, here's your Lay's, here's your Laura Dunes. You want a Sprite? I got the ice. There you go.
Literally.
Have a great day.
Yeah, exactly. What would you say is the hardest lesson you've learned as a bedside nurse?
Everyone's not your friend.
Yeah.
And unit culture matters. And I think that is the biggest thing. Like you are there for the patient, but then you're also there to cover your own butt and know that like you have to be on your own. You have to be a good autonomous nurse. Although teamwork is important, you also have to be able to work well with others to be a team member, and knowing that you're charting the right way, charting all the things.
Oh my God, that's still to this day, I'm like, okay, I got to make sure, like, still learning curve. Yeah.
It's a lot, especially when things happen. Like I had to learn how to, like really sequence my events because some things would happen during the shift and it can be 3 different patients having something going on or whatever. But I've learned to just 7:45, this happened. 8:15, this happened. 9:15, 10, 11, 12. Whatever happened during those times, I just have to write the time down and understand that like that is a timeline that you're building for who's reading the report. Because had something happen or when something does happen or whatever, they have something to look back on and you just are very factual. So I definitely think that you can't get sloppy. You cannot get sloppy. That's the biggest thing I have learned is because some things do become routine and sometimes you do feel more comfortable, but, yeah, you don't get too comfortable. Everyone's not your friend and make sure you chart like you will lose your license and be called into court.
Yeah. Honestly, I got kind of like lazy in the middle of like my like nursing and then something happened and it was like
kick that start back up.
I was like,
Woke you right on
I'm charting every freaking
towel request.
No,
you want
literally.
a snack? I gave him 5 pieces of
No, I start like I know that there's
because if they silently aspirate or whatever, and it's like, well, what'd you give him? You gave him cookies. He's a puree diet. You're like,
know.
You know what I mean? No, I gave him puree. Check the chart, ma'am. Check the chart. You know what I mean? Seriously.
No, it's that important. Sometimes if like I'm not being listened to now, like I'll add photos and like do stuff. Like I'm just like so scared that, like you said, because it's so easy to get comfortable in kind of routine.
When you get a routine, it's nice to arrive there because you're not drowning all the time.
Yeah, but then something happens and you're like, I wonder if I took the time to chart. Like it was been so long. I wonder if did I write that? Did I? And now I'm like, I'll stay extra just make sure I do it.
Yeah, and that was another thing too. I feel like when you are drowning, when you're first doing nursing, I was the first to be out the door. Like I'm like 7 o'clock, it's time to go. Like, you know, and that was just so not
realistic.
Yeah, it was. I think for me, no matter what, I was just like, I need to get done. I want to chart. I want to get this stuff done and get out of here. But like, because it's such a long thing. Like 12 hours are so long.
It's not even 12 hours, girl. It's like 13
and all
minimum.
the things that you do in that shift, like, come on, can you even like breathe? So when it's time to go, it's time to go. And I don't want to stay another hour to chart. But now I'm just like, girl, I'm going to stay and I'm going to go downstairs, and whatever happens during this time, at least I know I did what I had to do. And that's all you can do is what you have to do. But if you don't do that, they always have something to use against you.
100%. Yeah. How has your definition of a good nurse changed over the years?
I feel like sometimes, like when I first came into nursing, you want the nurse who is the nicest to the patient and the patients love them. That is good. But it's more than just being liked by the patient. Are you doing your job? Are you flapping your lips? That is something that I was like, and even just still, like, I just feel like sometimes people, they talk, but when it comes to, did you change them? Did you get their, are they comfortable in bed before you leave? Like, did you set the next person up type of deal? Like, I run heavy on that. That's like my biggest thing. I hate coming into my room and I know, oh, I love Mia. You know, she's nice. She talks, we talk, we vibe. We're talking all the time. Yeah. So you think they're a good nurse until you follow them up after your patient and you're like, girl, no, you didn't. You didn't leave my patient like this.
I've actually experienced this before.
With someone you actually like.
Yeah.
Because they talk so well. People have the gift of gab. They have the gift of gab and you're just like, oh my God, you're just like, ah.
I've actually experienced this exact thing that you're saying.
And that's the thing. That changed my definition of a good nurse too, because you start realizing like you just get away with just because you talk so damn much. You know, 100%. Like you're just
likable.
You're just likable. And you're not both. Let's just get that right.
Yeah,
you know. So that really changed my definition of a good nurse, because I think a good nurse is someone who takes care of their patient. Like you should not, when I come in and I have a new admission, their blankets and stuff are from up under them. If they're wet, their diaper is changed. Everything is happening within those 20 minutes of them getting there, not 4 hours or 2 hours or something like that. Like that to me is lazy, and I don't like a lazy nurse. I just don't. And you have to take pride in what you do, even if it's like taskmaster it, get it out the way. It's the grunt work, but you're gonna always be doing the grunt work.
And it needs to be done.
And a good nurse to me is someone who doesn't mind getting their grunt work in, getting their hands dirty. And I'm not saying you have to like, oh, this is the way of life. Like, oh, always be down for the struggle. But do what get it done, move it on, help get your patient together.
100%. Yeah,
the bare minimum.
You'll be surprised how many people are liked, and then they
that's tech work.
They're type of neglectful.
That's tech work. Yes. I can't do that. Or I don't know. Can you? Or they'll pass it to their aide or something like. Can you go in there and get so and so together? But mind you, the aide's giving baths and showers and stuff, getting their people together for bed. But you can't take the time to assess your patient, look at their butt, look at their stuff to see what it's looking like, and it's your admission. Like get it together.
Don't you want something to chart? Like, don't you want to look at your patient?
You don't want like, and it's like, and I get it, but like, at least get them together and tell them, hey, I'm coming back. It's crazy out there, but I'm your nurse. I'm going to get you together. Things of that nature. I feel like certain nurses who don't do that, I look at them with a real bad, bombastic side eye. Like,
oh yeah.
Girl, you know you wrong. Like, don't. So.
I love that. You actually said that really good, because I didn't notice what you were saying until you said it. And I was like, actually, I've experienced exactly what you're talking about.
Yeah.
Charisma, but no follow through.
Nothing.
So you've worked most of your career on night shift.
Yes.
Right?
Mm-hmm.
What would you say most people misunderstand about night shift?
That we just hang out. That you don't do anything and the management's not there, so you can put a blanket on and relax. Girl, please. Like, I feel like that's what the social media, like, oh, it's night shift, da 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 da. But I feel like depending on what hospital, if you work in a hospital, nursing home, or whatever, or rehab, or what have you, but night shift, where I'm at currently, and even just over the years, night shift gets all the admissions. Night shift gets all the patients when things start going down. Like, they'll be good during the day, but that's when them sundowners start coming in. Like, you be fighting for your life. Like, it's just a lot. And then, I mean, it's crazy because I think that's the biggest misconception is that, oh, well, you're on nights. Y'all don't really do too much. Family's not there. Management's not there. You get away with much more. And it's like, no, when all the nitty gritty goes down on nights, then you're stuck with less resources. You don't have the resources. You are the HUC, the nurse, the EVS, the mail carrier, the blood carrier. You know what I mean? Like, you're doing all of the things with way less. So I don't think it's like, oh, it's so easy. You get an admission the second you walked into the door. You know what I mean? The second I'm in there, you're just like, oh, your patient's here.
Yay.
You're getting here at 6 a.m. There is no patients that are there. There's very rarely, even in the hospital, and I have work days, there are very rarely admissions at 7:30, 8 a.m., even from another unit, unless it's coming from the ED, but you've getting a little bit prepared for that, you know. They probably still came up at 3 a.m. night shift, you know what I mean, prior to the day shift getting there. So I definitely think the biggest misconception is like, oh, everything is a little bit easier. No, people aren't there. You are autonomous. You have only the coworkers that you're working with. And honestly, I think you have to be a better nurse don't come here and try to be lazy, honey, because that's not going to work. And not the people I work with. You'll be gone by the morning because it's like, we don't need another warm body, honey. Go do that on days. Like, go do that where you have the extra support, because if you don't, and it's just night people, and we get down and we're helping and we're doing things and you're just not following up on your patients or whatever, it's just kind of like, we work. You know, and there's a time and a place for everything. My mom always say that there's a time and a place for everything. There's a time for rest. There's a time to cackle on nights, you know, to wake up or whatever like that. We may have like, you know, some loud talking sessions or whatever, but them first 4 or 5 hours, we are busting butt. And then them last 4 hours, we're busting butt. Don't be doing too much of this. You know, come on, keep moving, you know, so.
Do you see yourself always being a night shift nurse?
I do. Unless something had to drastically change. Like, I feel like if I was gonna have a baby or doing something of that nature, then yeah. But I just honestly, when I worked nights, when I worked in Cleveland, I had to do 2 12s and 2 8s, and it was rotating days and nights. And when I was on days, my body was physically under stress. I felt it. Like, I could not do it. Like, my body hated it.
Wow.
It could not relax at all.
That's how I felt on night shift.
No. Yeah. I would wake up and everything would be just like I couldn't even pee. Like, I couldn't pee because of just the anxiety of it, I believe. I think my body physiologically, no.
Interesting.
Then when I would go on nights, like, I would look forward to going on vacation and be like, oh, well, I don't have to be at work I don't have to be up until 4 p.m. Like, I can go to sleep for a few hours and do A, B, C, and D and then go to work. Like, I knew right then and there, oh yeah, my body just feels better. So like, even now, I'll wake up at 3, go to the gym, get ready, come home, do my lunch, and honey, I'm ready. It's 6:30. Let's go. Like,
I see all your reels and, you know, all your content, which we're about to get into, but I'm like, this girl says no to nothing. She is always on it. Like, you're always up to something in a good way.
Yeah. Like, it keeps me consistent. And I know that, like, but when I do work days, like, even when I did pick up days, even at the facility right now, I don't even think I ate. I didn't eat. I couldn't eat. It's not like I didn't have the time to eat. My body wouldn't let me eat. I wasn't hungry. And then the next thing you know, it's like 9 o'clock at night. And I'm like, I need to go to bed because I'm so tired. So like, even if I did pick up on days, it just was not the vibes.
That's my like exact experience for nights.
Yeah.
Have you ever questioned staying in nursing?
I have. I feel like when you are in this field, you have 1 or 2 ways to go to cope. you either have to figure something else out, go do something else, or a lot of the people who I went to college with and hung out with, we were heavy drinkers. We drank, we hung out, we did all the things, or travelers or whatever have you. But that's changed now since I'm like my friend group now really don't even drink or anything. So, but I feel like I had poor coping mechanisms when I was first started nursing. And when I didn't know how to process the things that you see every single day, the emotions that you carry from the beginning of your shift to the end of your shift. And I hated it, because it's just too much. It's like, who's supposed to live like this? Like, why? It was just too much. So I think having those constant negativity and negative thoughts and stuff, it really it kills morale. Let's just say that in the worst way. Then personally, something happened to me personally. I got pretty sick at a point in time. And my health was like, not in the best place. And when that happened, it literally woke me back up. I think it happened at the best time too, because it was just like a spiral. It was just going down. And I feel like when that happened, I'm like, girl, this is bigger than you. Nursing is bigger than you. This is a job. You can't let a job stress you out to this point. You know what I mean? So I had to strictly invest in boundaries and like know my own self and give myself a routine and a schedule and what worked for me. Because if you're just going by what everyone else does, you're not everyone else. And I'm not everyone else. So I definitely had to find out what was working for me. And when I bounced around in different facilities and stuff. And I think this pace that I'm at and where I'm at right now fits what I need to be. And that's why I've been at the same place for about 6 years by myself.
Wow.
Because it gives me that good balance. And it's not just like, oh, I can go somewhere else and make more money or whatever. Yeah, but the grass is not always greener, So I definitely feel like I've learned a lot more, and I've gotten like my spark back when it came to like my nursing thing. I feel like because the place that I've been at now, I've won 2 Daisy Awards. I've just loved the patient community that I've served. And I think given that perspective and knowing that I am making a difference and I have a good work-life balance, like I didn't have to work, mandated rotating days and nights, weekends. They make you do these things that you feel like you can't say no to when you're at a new facility as a new grad. And oh, you got kids? Oh, well. Oh, you got to go somewhere at noon? Oh, well. Like you can't because you have to get a point or you have to do this, or they're just not very flexible with your schedule. Some facilities or just being a nurse in a 12-hour shift is just not a very flexible thing to be.
Yeah.
But I do feel like having those irritabilities and stuff, and now being somewhere where, although I don't get my way all the time, I appreciate it more because I'm like, you know what? It could be worse. It could totally be worse. And it's not that bad anymore. It's not. So I'm okay with that. And with that, I know that I can still give good care. I can still take time for myself. I only work once a month for the weekend, like weekend once a month. And that's like a privilege. Like coming from where I was, you had to work every other weekend, every other thing. Yeah. And to work every third weekend was like unheard of. So I had to take that and be like, you know what? I'm going to maximize that. How is this going to work for me? And that's how I feel like every nurse needs to be when it comes to this career. How will it benefit me? Because if you don't, you will find yourself in a spiral of just not being positive. You won't, for me, that's how it was. So I think I had to gain my spark back. And once I gained it back, I said, okay, well, this is what I need to maintain moving forward.
A point that we can, gather from what you were telling us is like, if you're not enjoying yourself, maybe you should switch and see if that facility or that unit or, working in this environment can actually change how you feel about nursing in general. Yeah. Because it might just be where you're working. It is. It might just be who you're working with. So before you leave nursing. Yes. Yes. When you're at your lowest and you're like, not having good thoughts and, in a negative place, it's like maybe before you leave, try something else.
And that's why, like, it's like when you ask about the Med-Surg question, it's not easy. Acute care is not easy. It will take everything from you. Yeah. Literally every day. You're like, please, why did I come here? Like, why did I choose to do this crap? So that's why I say, like, I am a rehabilitation nurse now. I'm not, we have acute care patients, but like, honey, we don't do that acute care over here. We send them we call 911 called hospital. Okay. So like, and I'm okay with that because it gives me something to do. It gives me keeps me on my toes. But then also it's like, as soon as it gets too acute, Bye. You know,
I do miss that. Working in an ICU is like
you are
a patient is going down. There's nothing left. I don't like that. I always loved, even on Med-Surg, that like, oh, shit's going down.
Time for you to go.
You need to go.
Take them someplace else. You are going to go see the professionals.
You see people who know more than I do.
You know what I mean?
I love that.
Yes.
Love it. It's a security blanket.
It is.
Now I don't have that. It's like, your patient's sick. You better be calling and documenting correctly, because
all the doctors, all the documentation, you are the last stop.
So you have built a platform educating nurses. What inspired you to start making content?
I've always kind of thought about it in the back of my head. I had a lot of friends who were in the content area and space and things. But what made me start creating content was I just needed a creative outlet. I felt like when you open yourself up for things, that if you want something, things will kind of come to you. And I knew that if it was going to be a learning curve, but I wanted a creative outlet, and I didn't know how else to do that but start social media. And that is an extra stream of income. If it could bring it to me, you know, I'm gonna take it. Yeah. And, you know, and that was it. That was a mindset. I was like, I could use an extra stream of income. I don't know how that's gonna look. I'm not really sure exactly what it's gonna look like. But also, if you don't know, if you don't try. So let me learn some things and let me optimize, and learning a new skill, because I know nursing and it's fine. But at the same time, like, how can I make this a creative outlet to bring rewards to myself and to make a little extra money on the side? You know, that was just the thing. I don't know how it's going to happen, but that was what started it.
So where can listeners find your content?
So I am, it's Ashley RN.
Okay.
And you can find me on TikTok and on Instagram.
I love all your content. It's so good.
Thank you.
And you're very consistent. I'm like, I need to get like her. Like, you're almost like every day, every other day.
I do it 5 days a week. I do Sunday through Thursday.
And another thing, it matters who you work with. Oh no, we just co-workers. Oh no, I don't go to work to make friends. In nursing, it 1000% matters who you work with. If you know, you know. If you don't, you'll find out.
And then depending on what day it is, I might post twice on like a certain day. Like, I might post twice on like a Sat, but it's different pillars. I like to kind of throw like, oh, is this educational content, or is it just lifestyle content, or is it educational content, or is it about my cats? Like, you know, so it kind of just divvies up. But I found a rhythm, and that was the hardest part.
I haven't found my rhythm yet. Yeah. Like, I'm like, here's a reel like once every 2 weeks. Yeah, or like, it's very difficult to be consistent. It's like, it's a brand new skill.
Yes.
You're not like told how to make content in nursing, obviously.
No.
So you got to learn how to like use all this social media and it takes a long time.
And to maximize it. And it's a whole thing. It really is. And I didn't know. I didn't want to be that creative. Like, that was the thing. Like, I was like, oh, this is gonna be. And then I was like, oh.
No, like, you think it's like fun, and then like you start and it's like almost like a chore.
It is. It becomes like a part-time job for real.
No.
And like, yeah. Seriously. So
you could spend hours a day.
It was becoming too much at first. Like, when I first was learning everything, I just was like, I can quit today. I don't want to do this. And then once this opportunity came up, it's like, okay, this is something to look forward to. And then other things kind of start popping up, and people wanted me to just be a part of their platform or what have you. And then I said, you know what? Well, now that I have this other background, I can come back in. I can actually join these platforms and make content for these brands, if that is what I so choose, you know. But creative, yes.
It's so hard.
A lot more than what I expected.
Yeah.
Yes.
Yeah. I saw you got your first PR box.
Yeah.
That's awesome. I haven't gotten that yet. That's a big milestone.
It literally happened. Everything was happening like right at the same time almost.
You're like, oh, okay, this is where I'm supposed to be.
Obviously I'm doing something right.
Yeah.
It was. And so that was actually really fun. I'm happy about that. And they actually posted my ad like the other day. I was scrolling and I saw me, and I was like, this is what I want. It's happening. You know, I was like, and it's funny, I was telling my cousin, I was like, you know, everything I set out to do when I first initially thought like I could be on a paid ad commercial. Well, I was just recent, you know. That's so amazing. That was really cool. And then being here with you, like, that was just this whole situation is just like full circle because it was never in the cards to think about at all.
Oh yeah, of course. So that's amazing.
Yeah.
I'm excited for you.
Thank you so much.
So how do you go about making like complex nursing topics easier for people to understand? Because I know that's your goal, but how do you go about that?
So I failed my NCLEX when I first took it. And I feel like when you know the information, but you don't know the information, you don't know how to apply it. And I feel like when I learned that way, I had to learn it a way that made sense to me in bite-sized pieces. And I went to, once I failed, I went home to Cleveland and I just went to a review program. I paid for it, did the things. And the way that instructor broke everything down along with my knowledge of doing UWorld and everything like that and nursing school. So it was like all three of these trifecta brought it together. And I was like, oh my God, it finally makes sense. I was like, it finally makes sense. Like all these things finally make sense. And then with working and experience, I feel like now I can just deliver it because that's exactly what I see, you know, from the things that finally start making sense per NCLEX and all of that stuff, then I can kind of bite it down to my bite-sized pieces and then kind of present it like that in a 3-step way or in a 5-step way. And I think that is what really kind of makes it make sense. Because I can't teach you everything. I'm not going to say I'm going to teach you all the things of the NCLEX or all the things of nursing, but I can tell you how this stuff looks in real life and how it also applies on the NCLEX and at the bedside, because that is something I have lived through and I experienced and I know it. and now I'm like, and I know it. Yeah. That's the thing. So, and when you know it, you know it. And that's just it. So I felt more confident to be able to deliver it in that way from everything I've learned. Because I know a lot.
Yes. So, and just talking to you, you've actually mentioned that you went on a missionary trip, and I'd love to hear more about it.
Yeah, I went to Kenya for nursing. The lady who runs it is called Nurses with Purpose. And one of my traveler girlfriends who I met while travel nursing, she went on one. And I see her in Africa. She was like in Johannesburg. And I was like, that's amazing, because the college I went to was a Christian university. So I did do missionary work back in the day. And I just thought it would be so cool to be an actual nurse, because when we were nursing students, they used to do medical missions in my school, but they stopped it because of something kind of crazy went on or whatever. So they just kind of stopped doing it. And I felt that this time was another time to be able to like go serve. And I think everybody should just be selfless and serve, you know, at some point in your life. I feel like it's a really great decision to make. So we went to Kenya in 2023 and I had like 3 suitcases. I had one big suitcase full of medical supplies, just chucks and all the things, Tylenol, things that you buy from the dollar store, really, over-the-counter medication that they don't have in Kenya. And then just another bag just full of clothes. And we stayed there for probably like a week and a half or something like that. And we were working with the local church and we just pretty much provided clinic care. They came, they had a clinic day. We would look at their eyes, do eye vision and give them glasses, things of that nature, like give them the readers and stuff. So if they had like any like wounds, we would clean it up, dress it, give them peroxide to take home, because we went to the villages and in Kenya. So when we got there, when you fly into Kenya, you have the city, but then we went to Nakuru, and I cried when I left. It was so amazing. It's just amazing. Those people are so grateful and they just love us, and just being able to experience something outside of yourself, you know? And so we flew in and then we went to the local village and we stayed there for like 4 days. And then when we left, she just had such a good system. When we left, we ended up going to like this resort. It was a game resort. So we got to go on the safari. We got to see 4 out of the 5 animals that are in the big 5. So that was extremely exciting. And like I said, just being in a selfless position and being able to serve, and then also having time for your downtime. And I just loved it. I loved every part of it.
I think it's a perfect combination if you're a traveler, which I assume you are, and then you get to help people, so you're empathetic. Yes. And then, you know, you get to use your nursing skills. So that's one thing.
It's educational content. Yeah, it's educational as well.
Amazing.
Yeah. And when you really think about it, all nurses are educators. You know, you have to be. You literally have to be.
It's literally your job.
It's literally your job.
So looking back on your career, what moments are you the most proud of?
Oh, man. I have a lot of good moments. I do. I feel like I said, I've won 2 Daisy Awards, and just being able to be that much of an impactful person for a family in such a hard time is never going to get old. And just seeing how much appreciation they have while you take care of them, and to be even nominated or recognized in that way, especially even from like a facility. So I just know I give great care. And I know that when I give great care, it's reciprocated in such a appreciative way, because sometimes in nursing you do feel like it's a selfless job. It is selfless. You do a lot for everyone else, and you don't get the thank yous or the pleases or whatever. You get the snappy, get in the bed, close the door, go to sleep. Like, you know, it's just like,
yeah.
you know. But like, I do feel like in the past 5 to 6 years, I've had a lot more patients who have been more grateful for my education and things of that nature, and I've been able to help them in a way that is tangible and recognizable. So
it's amazing.
Yeah, I definitely feel like I am making that difference, and I do feel that way. I there have been times I have not felt that way. So when you do get that recognition, it's just like, I don't want to leave.
I know.
You know, like, yes, I do all the things. Indeed, you're welcome. You're welcome. You know,
pat on the back,
thank you. You know,
honestly,
so it's
you know,
nice.
Getting that recognition can cure you for a couple months. Like when you're at your low, and then something like that happens, you're like, okay, and then it's got you for like a couple months.
It does. It makes it the difference. It really does. So I am proud of that, and I get that more frequently than I have ever gotten it prior. So yeah.
Good. Okay, so finally, in closing, what's something you hope someone would take away from your episode?
I always continue to develop in nursing. You know, I feel like sometimes like they do try to pigeonhole you. Are you going to go to your nurse practitioner or things like? Don't be afraid to be bold, be broad, and keep learning. That's it.
That's it. Yeah.
That is it. All within a nutshell. Be bold, be broad, and keep learning.
100%.
Yeah.
You said it beautifully.
Thank you.
Well, thank you so much for coming.
Thank you for having me. I'm so happy to be here. This is amazing, and you were just as sweet as I thought you would be.
Oh, thank you. You did amazing.
Thank you so much.
All right, guys. Well, don't forget to like and subscribe, and we'll see you in the next one. Bye, guys.
Thank you.